Hi everybody. In the last several videos we've been talking about Dr. Bredesen's Recode protocol for reversal of cognitive decline, which has been a crucial program for my dad. Dr. Bredesen's team has helped hundreds of people reverse their cognitive decline, establish mild cognitive impairment, and Alzheimer's disease with this protocol as evidenced in successful studies in 2014, 2016, 2018, 2022, and current clinical trials. Today, we're continuing on with the Cognoscopy, Dr. Bredesen's diagnostic framework for screening all the potential contributors and risk factors for cognitive decline. All these tests and lab results paint a clear picture of where a patient stands and helps identify how they got there. It is the foundation for an individualized protocol to be built out for prevention or reversal. On the last episode, we specifically talked about the very important lab marker, HDL cholesterol. Next up, we're coming over to LDL cholesterol. So, what is LDL cholesterol? Well, let's recap our last videos on total cholesterol and HDL cholesterol. Cholesterol is an essential lipid, a fatty substance our bodies need for building cell membranes, making hormones, and vitamin D. It also plays a crucial role in brain development, function, and overall health. It is a vital component of cell membranes influencing neuronal structure, signaling neurotransmission, and is essential for myelin and synapse formation. And even though cholesterol has been vilified for decades via the lipid hypothesis, high cholesterol itself is not the problem as much as it is when present in conjunction with insulin resistance. Check out episode 101 for more details on this. If you remember, the total cholesterol blood test measures the sum of HDL cholesterol, LDL cholesterol, and 20% of triglycerides in the blood. HDL cholesterol, also known as the good cholesterol, has anti-inflammatory properties and is associated with a lower risk of heart disease, stroke, and cardiovascular issues. HDL also helps grow and repair neurons, helps in the clearance and excretion of amyloid beta, suppresses inflammation in the brain and blood-brain barrier, and promotes better blood flow and nutrient delivery to the brain. Okay, so what is LDL cholesterol? LDL, or low-density lipoprotein cholesterol, is a type of cholesterol that is often referred to as the bad cholesterol. As a combination of cholesterol and protein, LDL helps carry cholesterol from the liver to the body's tissues and plays an important role in the building of cell membranes and the production of hormones. High levels of LDL cholesterol have historically been associated with its accumulation in the arteries and formation of plaque, which can narrow blood vessels and increase the risk of heart disease, stroke, and other cardiovascular problems. Standard of care's general recommendation for LDL cholesterol is below 100 milligrams per deciliter. We're typically prescribed the statin medication for lowering LDL when levels are between that 129 to 190 milligrams per deciliter range. I'm not getting into statins in this video, more to talk about on that in the future. Generally, it's been regarded that the lower the LDL number, the better. Now, Dr. Bredesen and his team have seen LDL levels all over the map associated with optimal cognitive health and function, and there hasn't really been a target level. He's seen that HDL levels at or above 60 milligrams per deciliter, as well as total cholesterol levels at or above 250 milligrams per deciliter, have typically been associated with better cognitive function generally. Although LDL levels are very unique to everyone and are heavily dependent on other risk factors like genetics and metabolic health risk factors like indicators of insulin resistance, Dr. Bredesen does recommend LDL levels to generally be under 200 milligrams per deciliter. But he also cautions singling out LDL and aiming to aggressively reduce it without first also looking at markers of insulin resistance like fasting glucose, hemoglobin A1C, and fasting insulin, as well as triglycerides and oxidized LDL, which we'll get into in future videos. In fact, he stresses oxidized LDL, LDL that has been damaged by oxidative stress and inflammation, to be a better marker for increased risk of heart attack, stroke, and cognitive decline. More on this in the future. Although LDL cholesterol has been dubbed the bad cholesterol all these years, it does have important and vital functions in the body, like providing building blocks for cell membranes, being the precursor for the production of certain hormones such as vitamin D and sex hormones, contributing to the production of bile acids, which are essential for fat digestion, wielding antioxidant properties that help protect us from oxidative stress and inflammation, and helping regulate blood pressure. A fascinating study published in the American Journal of Geriatric Psychiatry in 2008 followed 185 participants that were non-demented. Their ages ranged between 85 and 101. The study found the best memory and cognitive function measures on cognitive tests in those participants with the highest levels of total cholesterol and LDL cholesterol. Interesting. I've linked that study in the description box below. Focusing on LDL in a vacuum, vilifying it, and targeting it for its reduction without taking other markers of metabolic health into account may be counterproductive, as it doesn't give us the full story. Undoubtedly, high LDL, when in the presence of out-of-range fasting glucose, hemoglobin A1C, fasting insulin, triglycerides, oxidized LDL, BMI, and type 2 diabetes, is a problem that must be dealt with. When these are out of range, this signals metabolic dysfunction, and metabolic dysfunction drives cognitive decline. When testing for cholesterol in relation to brain and cardiovascular health, we must also always test for insulin resistance markers. Check out episode 14 for these. Dr. Bredesen has found that insulin resistance is the single most important metabolic contributor to Alzheimer's disease development and progression, and that the biggest drivers of insulin resistance for us are diets high in simple carbohydrates such as sugar, processed food, full of high fructose corn syrup, sedentary lifestyles, poor sleep, and chronic stress from work and home lives. But he also found that the antidote to reversing insulin resistance, restoring insulin sensitivity, and improving cognitive function was optimizing the right diet, exercise, sleep, and stress management programs within patients' protocols. These are the core pillars of the Recode protocol. If you're asking, how do I get tested for these labs to assess my Alzheimer's risk? Check out Dr. Bredesen's website and episode 12, both linked in the description box below for more information. And I'd love to hear from you. Has your neurologist ever spoken to you about your LDL cholesterol levels? What do you think of this video? Please drop me a comment. If you found this information helpful, please feel free to share this video with anyone you think it could serve. And please like and subscribe, as it helps our community grow. And remember, I'm not a doctor. I don't have a PhD. I'm a caregiver and citizen researcher on the ground, helping a loved one, someone just like you. This information is for educational purposes only. Please consult your medical practitioner before implementing any changes. Thank you for watching. My dad thanks you. Hope these resources are helpful to you and your family, and see you in the next video. Thanks.